Hi, this is a case discussion. You have to look at this picture and you have to tell what are your positive finding. So my positive finding here, looking at this gentleman grossly, I can notice that there is a distension of the abdomen, and also I can notice there is wasting of the muscles. So these are the two findings that grossly I can see. When I look more closely, I can notice that there is prominent vein can be there, and it is visible through the skin. Also there are some red spots are there. The red rash is there on the chest and also here. So it is a spider nevi. When you press it, it will disappear, and when you will leave it, it will come back just like a spider. In the another picture you can see this gentleman that there is some skin changes are there. You can notice that there is some pigmentation or a more dark discoloration of the skin. This is we call hemochromatosis most likely. Also we can look at the hand. Also we can notice there is wasting of the muscles. Also here on the face, cachaxic look is also there. When we look at the abdomen, it is distended, that is quite clear. And when we look at the umbilicus, you can notice that it is everted. Also when you look on the flank, you can notice that the flank is full because of the fluid, most likely is having ascites. And there is some dressing material, most likely the fluid was removed, that is why he is having this dressing material. So next once you have all this finding, you can understand that this gentleman is having chronic liver disease. So once you find out that this is having the chronic liver disease, you have to look for some stigmata of the chronic liver disease, and these stigmata are starting from the face. You will look for the jaundice and parotid swelling is here or not. More noticeable thing is looking in the eye. You will find that there is icterus, jaundice, and when you look around the eye, you can find that there is fat deposition. That is what we call xanthelasma. And then coming to the hand, you can notice that this gentleman is having some changes in the hand as well. So what are those changes? You can find out that the most prominent is the redness, what we call palmar erythema. Another finding you can notice that it may be having clubbing, dupuytrenine contracture, and leukonychia, bruising, flapping tremor. These are also a finding you can notice in the hand as well. When we look at the chest, you can notice that there is enlargement of the breast. That is what we call gynecomastia. This is basically due to your liver is not able to handle the balance between testosterone and estrogen, and that lead to gynecomastia. Spider nevi, we already discussed about it. Looking to the abdomen, you will notice that there are some finding, as we saw in the previous slide, that the gentleman is having some dressing material. That is because there is paracentesis, the fluid was removed from his abdomen. Other finding you can also notice there can be a scar can be there, and in this abdomen here you can notice that is quite prominent abdominal distension, and also quite prominent vein you can see here, and the umbilicus is also everted, what we call its caput medusa. Other finding, when you palpate the abdomen, you can find out that there can be hepatomegaly, splenomegaly. Also on the percussions, also there is a shifting dullness. It is a sign of the ascites. Sorry. And other thing, you can look at the leg also, that there will be bruising because of the coagulation factor not be handled properly by the liver, that lead to bruising. Also fluid retention, or fluid retention as well. Fluid is in the blood, there is less protein, so that is also lead to edema also. So these are the stigmata of the chronic liver disease. Then we will come to the what are the causes of the chronic liver disease. So alcohol is the worldwide, it is most common, but there will be some clinical clue that you will get when you are examining the patient, such as there is a parotid enlargement, there will be also cachexic look, Dupuytren contracture, peripheral neuropathy. This give you clue that this gentleman is most likely alcoholic, and you have to take the history properly. Chronic viral hepatitis is also common cause of the chronic liver disease. Hepatitis C, so you have to, while you are examining, there can be tattooing mark, and also there is IV drug user can have needle stick mark, so that is giving you a clue that maybe he is having hepatitis C. Hepatitis B nowadays less common in the developed world because of the vaccine available for the hepatitis B, but developing country it is still common. Another common cause is non-alcoholic steatotic hepatitis, in which there is fat deposited inside your liver, and that lead to rearrangement of liver enzyme, also sometimes lead to cirrhosis as well. So it is associated with obesity and metabolic syndrome. Other common causes autoimmune conditions, such as the most common is primary biliary cirrhosis, but there is again a clinical clue that you can get, such as it is middle-aged woman, there will be a scratch mark because of the intense itching in this patient, so itching and scratch mark is also important to look for. And there will be another thing, that fat deposition that is around the eye, what we call the xanthelasma. So if these features are there, you can think about the primary biliary cirrhosis. Other autoimmune condition is also primary sclerosing cholangitis, autoimmune hepatitis. So some blood test and some blood marker is also there for that. Other things that is less common, that is hemochromatosis, that we saw in the last slide, that is iron deposition in the skin. So it is due to either more absorption of the iron from your stomach, or it's maybe due to iron overload, either by giving more transfusion of the blood, or such as the thalassemia. So this can be the reason for the hemochromatosis, either hereditary or iatrogenic or some other disease associated. Complication of the chronic liver disease is the portal hypertension, also hemorrhage, but you have to remember that the hemorrhage, when it's come with the chronic liver disease, we think about the visceral variceal bleeding, but it is not true. It is not variceal bleeding the most common, but most common is gastric ulcer and erosion, even in the chronic liver disease. So in the chronic liver disease, the more common is gastric ulcer and erosion. Ascites is another complication, spontaneous bacterial peritonitis, hepatic encephalopathy, and also hepatorenal syndrome and hepatopulmonary syndrome. Hepatorenal syndrome because your kidney assume that there is less blood is coming and start water retention and sodium retention, and that lead to hepatorenal, and there is basically vasoconstriction inside the kidney is going on. And in the hepatopulmonary, there is opposite to that, there is vasodilatation inside the lung, and that lead to mismatch perfusion inside the lung, and that lead to hepatopulmonary syndrome. The treatment issue is depending on the different type, different cause of chronic liver disease. If the patient is alcoholic, he has to stop the alcohol, he has to stop any kind of the liver toxic drug, so that is there, and also treat the complications, such as if the patient is having ascites, you have to less salt intake and spironolactone, depending on the different situation and different complication. And hepatitis B, C can be treated with the antiviral treatment. Hemochromatosis venesection. So different cause treated accordingly. So please give your comment. Thank you very much.